Hello everyone, my name is Alyssa and I'm going to be reading you my article report speech. Have you ever wondered how difficult it was to be a nurse? Most people never realize how difficult it really is for a nurse to tell a patient bad news. Most nurses prepare themselves to tell the bad news. They also need to use good communication skills. Today I will be trying to inform people how to prepare themselves to tell a person or a patient bad news. The article I read was Communicating Bad News, a Reflective Approach by Deirdre McGuane. The article's topic was to inform people how difficult it was to tell a patient or a person bad news. Being a nurse is a very unique and challenging job. Sometimes nurses do not have a good nurse-to-patient relationship. To help accomplish a relationship, they need to engage in conversations. Also, they need to use effective communication skills. The hardest time is when they have to tell the patient the bad news. Most nurses use 5 timeouts to help them get ready to tell the patient bad news. Timeout 1 is a reflection. A nurse reflects on a situation when they had to tell a patient bad news. This is a time to ask different questions to yourself and prepare themselves to tell the patient. The timeout 2 is to help the nurse make a list of what they think the main barriers of effective communication are. This is the time to think of how they are going to be effective to the patient and to help calm the patient down. Timeout 3 is to imagine. Imagine a story to help them try to understand how they are going to approach and make a conversation to help the problem. Timeout 4 is to think. The nurse needs to think of things that you could have done better with the last scenario and try to accomplish them in the upcoming scenario. Timeout 5 is to tell the bad news to the patient. Try to keep the patient calm also. Telling bad news is never easy for anyone. This helps to show some ways to prepare people to tell bad news. I hope all of you have learned a little about telling bad news and how to prepare for it. Every day nurses have to tell bad news to patients, and they use effective communication skills to help keep the patient calm and to help the patient understand. Being a good communicator will help if you ever need to tell bad news. Thank you all for watching this article report speech, and I hope you all have a great day.